This is QD Clinic, and I'm Jack Cush with RoomNow.com. QD Clinic is brought to you by RoomNow.live. Now's the time to register. Meeting's coming up soon. Today's case is Notalgia. Many of you know what Notalgia is. Others are thinking, I have no idea what that is. So this is really about the diagnosis of fibromyalgia. Saw a patient yesterday, came in with a history of POTS, and I don't know what the rest of the history was. It really doesn't matter. If she has POTS or he has POTS, you know they have fibromyalgia. And now you're going to spend the rest of the hour or 40 minutes figuring out what they don't have, making sure they don't have something more sinister. Because fibromyalgia runs with other disorders and it should be easily diagnosed. I'm doing this one because I'm sorry to say many rheumatologists don't make this diagnosis when they should. So I'm going to give you the benefit of my 37 years, my 72,000 patients seen, and I'll let you know that I made lots of mistakes to get to where I am today. I've missed a lot of FM diagnoses. I don't miss them anymore. I spot them from a mile away. Often I spot them just looking at their survey sheet or their medicine list or their review of symptoms checklist. So let me just, in a short few minutes here, give you a review of when you know it's going to be fibromyalgia. And but when I say that, I mean it's definitely greater than a 50% chance they're going to have fibromyalgia. And I'm saying, giving you these clues with the thinking it's greater than an 80% chance. If you think I'm wrong, please let me know. I don't like being wrong. I do like sharing valuable information. So clue number one, someone who has a diagnosis of ADD, ADHD, and is taking ADD meds. They're going to have fibromyalgia because their ADD meds could sort of ensure that they're not going to sleep well. And then that leads to the cascade of amplified pain, etc. Anybody who has a history of depression, anxiety, and is taking depression meds is already at increased risk presenting to you for the first time with musculoskeletal complaints. They're at increased risk of having fibromyalgia. It may be part of their diagnosis. It may be their sole diagnosis. As I said earlier, someone with POTS, postural orthostatic tachycardia syndrome, again, these patients are at very high risk. Nobody says this, but it's absolutely truth. More than 50% of patients with Sjogren's syndrome have fibromyalgia. Yeah, I know they have dry eyes and dry mouth, and yeah, I know there's nothing you can do about it. Biologics, DMARDs don't help, but all the aches, pains, and arthralgias is not arthritis. It's all fibromyalgia. I would say 80% of people with Sjogren's syndrome have fibromyalgia. Patients who you have with rheumatoid arthritis or any inflammatory arthritis who are multiple DMARD failures or multiple biologic failures. Patient has been on methotrexate, leflunomide, sulfasalazine, hydroxychloroquine, etanercept, adalimumab, infliximab, 1-IL-6 inhibitor, abatacept, rituximab, and now we're considering, it doesn't matter, they have fibromyalgia, as opposed to you're waiting for exactly the right biologic intervention to magically cure this. Now, if they got swollen joints, I'm wrong, and you're right. But when they're doing lousy, and lousy is fatigue and widespread pain and hurt everywhere when you touch them, metrics. Metrics are the biggest clue. Anyone who does a CDI or a rapid 3 and the number is greater than 30, they're going to have fibromyalgia in play. Again, it can be on top of their inflammatory arthritis or lupus or spondylitis. My good friend Mark Cohen once said to me, he yelled at me and said, "You said that Behçet's was fibromyalgia with a canker sore." And I thought, well, gee, it sounds like something I might say. I was probably trying to be funny, but there's truth in my humor, meaning patients who have unusual and rare diseases that present to you, like Behçet's, like relapsing polychondritis, are way more likely to have fibromyalgia than Behçet's or relapsing polychondritis. You do, of course, know that ANAs without requisite symptoms for lupus are highly likely to have fibromyalgia. And then I have this very long list of things that we know are features of fibromyalgia, clues to the diagnosis. First off, everybody that you see for the first time should be considered as having fibromyalgia first, because statistically it's way more likely than a spondyloarthropathy or rheumatoid arthritis. It's about as likely as having gout, but everything else it's way more likely. Obviously, when patients have tons of complaints and nothing to show for it, so when they check every box on that review a system checklist, they're likely to have, again, a rapid 3 of 47 and numbers that, and again, lots of information that, again, they don't know what's important, so everything seems important. So again, a big, long, detailed history that's very complex, but yet they have nothing to show for it. That's sort of a clue. A globally positive review of systems, we call that notalgia. No, we call that positive organ recital. Notalgia, you're probably wondering what that is. Notalgia is when they bring in so many notes, you hurt. That's right. I've had patients come in with gigantic files on a dolly, one of the metal case 2-drawer files full of information. Everything's important, but really it's not. How can all that information be important? I don't need that much information making a diagnosis of cryoglobulinemia with renal failure and missing limbs, but it's prevalent in patients who have fibromyalgia. They have a lot of symptoms for sure, but they, again, don't have findings that go along with that. Multiple chemical sensitivities. I'm allergic to everything. I don't like taking medicines. Then why are you taking 11, ma'am? Patients who have, as I said earlier, any of the psychiatric disorders or depression or are taking psychiatric meds are likely to have fibromyalgia. Lyme disease in Texas. There is no Lyme disease in Texas. Again, it's a rare disorder. Fibromyalgia in Texas is way more likely than would be Lyme disease, but yet there are plenty of people who are misdiagnosed with bizarro diseases like Lyme disease. Now, if you're from an endemic area and you've had an ECM rash, yeah, Lyme seems like a good diagnosis. Hospitalized 6 weeks ago, still wearing ID bracelet. That's without explanation. And maybe the best finding, when I'm doing an exam and I start out in my hand and I squeeze that DIP5, and they say yes right away, that's worrisome. But when I squeeze on every joint and they're tender, but I'm not feeling synovitis or any kind of malalignment or physical abnormality of the joint, you should suspect fibromyalgia. Again, when they fold like a $20 card table, when you touch them, they have extreme hyperkinetic reactions to pain. That's amplified pain from fibromyalgia. Please don't make this mistake. Diagnose and treat fibromyalgia. It makes the management of inflammatory arthritis and other diagnoses all the much easier. Tune in for more QD Clinic.